Hey frenemas, Dr. Jake here. I've got an interesting topic to discuss with you today. A little less gay, a little more sad. I mean, don't worry, I'm still a gay doctor, that hasn't changed. It's just this topic is important and it's been weighing on me and I have to talk about it. Over the last few weeks, you may have heard about Radonda Vaught, a nurse who injected a patient with the wrong medication. She was recently convicted and faces a sentence of 3 to 8 years in prison because the patient died because of her medical error. And this is absolutely insane. And before I talk about this more, please hit the like button and subscribe to my channel. I talk about important health topics here, and that is the best way to support me and the videos that I create. So first, let's just go over the details. Ms. Vaught was taking care of a patient named Charlene Murphy. Charlene was in the hospital for a brain injury, and the doctor had ordered an MRI for her. However, because of her severe claustrophobia, the doctor ordered Versed, an anti-anxiety and sedative medication, to help her get through the procedure. MRIs cause a lot of anxiety for patients, and it's not uncommon to give a medication to help them get through it so that you can get a good picture of their brain. Versed is kind of a strong medication in this circumstance, but it's generally safe and will do the job. However, Nurse Vaught pulled out a different medication from the medication cabinet. She pulled out a medication called Vaccuronium. Vaccuronium is a paralytic. It literally makes it so that all of the muscles in your body shut down, including the ones that help you breathe. Most commonly, this medication is given when doctors are placing a breathing tube. It prevents the patient from removing the breathing tube by talking before it's secured. However, if you give this medication without placing a breathing tube, the patient is likely to die. Again, they just stop breathing because all of their muscles are paralyzed. And unfortunately, it's not a sedative either, so the person dies from suffocation while awake. And that's exactly what happened. Ms. Murphy was given this medication and then she died from suffocation. She died because this medication paralyzed her muscles and made her unable to breathe. Now, before I move on to the actual big question of the case, whether or not she should have been jailed, there are some other big questions that I need to answer. They're not the main focus of the video, which we'll get to in a little bit, but hear me out. Number one, did Nurse Vaught do something wrong? Yes, she did. She gave the wrong medication to the patient. That's pretty clear cut. Number two, did Nurse Vaught's actions lead to the death of this patient? We can't be 100% sure, as it's possible that she gave a smaller dose than would be required to paralyze this patient, but I admit that it does seem likely that this medication error caused the death of the patient. Number three, and to me the most important, how did this happen? This one's a doozy, and it's going to be a pretty detailed answer, and there's one more thing I need to talk about before we get into the answer to this question. So here's the deal, and here's what I aim to show with this video. The fact that this nurse was convicted of homicide, of murder, is a huge problem. It doesn't make sense at all. And to understand why this punishment is ridiculous, we have to talk about something else first. Medical errors. Medical errors are extremely common. They are thought to be the third leading cause of death in the United States. If a hospital reports 0 medical errors, there are not 0 medical errors. There are just people who are scared to report them because they're worried they'll lose their jobs. For that reason, many hospitals are now becoming what's called HROs, or high reliability organizations, encouraging all employees, no matter their position, to report not only errors, but also near misses, or possible errors that just didn't make it to the patient. For example, when a doctor puts in a wrong order, which is something I've done, and then it doesn't make it to the patient because the nurse or pharmacist catches that error. They also encourage staff to report errors that presumably cause no harm to a patient, like injecting a slightly smaller dose of insulin than was ordered by the physician. Most importantly though, reporting errors and near misses in an HRO results in no punishment for the person reporting the error, even if they're the one that caused the medical error. Why? Because you want to encourage people to report these errors so that you can create systems that prevent more errors in the future. That makes sense, right? The same for near misses. And in many cases, those near misses are just as important as the actual errors that are reported. And the reason for that is cheese. That's right, cheese. Specifically, Swiss cheese. I want to explain to you the Swiss cheese model of error prevention. Most people who work in medicine have probably heard of this. Consider that one piece of Swiss cheese is a person or thing that prevents an error from making it to a patient. For example, a physician double-checking their work or a nurse double-checking a medication in the computer before administering it. Now, the reason we say Swiss cheese is that Swiss cheese has holes in it. If you only have one piece of Swiss cheese, it's likely that one of your errors is going to be able to slip through one of the holes in the Swiss cheese and ultimately will make it to the patient. However, the key to the Swiss cheese model is that there are two ways to prevent medical errors from reaching patients. First, you can make the holes in the Swiss cheese smaller. For example, you can have a program in the computer that alerts a physician if they're ordering a medication that a patient is allergic to. However, you might notice that physicians are just clicking through that and saying, whatever, it's fine, they're not allergic. But that can lead to a serious medical error. So what you might do to tighten up that Swiss cheese hole is you might force the physician to write an explanation for why they are giving this medication. Now, there's another way of preventing an error, and that is stacking multiple pieces of Swiss cheese together. That way, even if a medical error makes it through one of the holes in the Swiss cheese, there is another piece of Swiss cheese there, and unless those holes line up perfectly, that medical error is not going to make it to the patient. However, there are some cases where those holes line up, clearly because medical errors are the third most common cause of death in the United States. So it's not perfect, but more pieces of Swiss cheese should mean less errors making it to the patient. So in this particular case, what are the pieces of the Swiss cheese that failed and allowed the error to make it to this patient and ultimately kill her? The hospital that you go to may do things differently, and I don't want to generalize. I want to talk about what my hospital does and what I've seen at the multiple hospitals that I've worked at. Ooh, my eye. So Swiss cheese piece number 1, the physician or non-physician provider orders the medication in the electronic medical record. 2, the computer alerts the physician if there's some sort of danger to the patient from the medication, like an allergy, and the physician has to go through multiple alerts to get that medication to the patient. The computer can catch a lot of errors, but it isn't perfect, so that order next goes through number 3, the pharmacist. They independently verify that order. Pharmacists catch a ton of physician errors because they are the experts of medication. They fix dosing errors, they notice medication interactions and allergies and a ton of other things that I don't really understand. And pharmacists, please comment and let me know what you do, because I know a lot about your jobs, but not everything. But ultimately, they will call me, the physician, if a medication seems dangerous and say, hey, do you want to change that? And we will say, in this case, let's just say I said no. Well, they approve the order, and it next goes to number 4, the nurse. The nurse goes to the medication cabinet and orders up that medication in the medication cabinet. These go by a bunch of different names. You might call it a Pyxis. I don't really know all of the names because I don't do this step. So I actually asked one of my nurse friends to give me her account of what happens. So let me just read that to you. First, the nurse has to select the patient's name. Then the cabinet brings up a list of medications that are available to administer to the patient, and then the nurse selects the one they want to administer. And then immediately after that, number 5, piece of cheese number 5 comes into play, and the cabinet gives the medication to the nurse, and in the case of certain dangerous medications like Versed, prompts that nurse to waste some of that medication. So essentially what that means is that if there's a medication that comes in a 1 milligram vial and I only order 0.5 milligrams of it, and that medication is a controlled substance or a dangerous medication, and the destruction of the rest of that medication needs to be monitored, that nurse has to throw it away. We don't reuse that small amount of medication on another patient. Now, Versed is one of those medications that needs to be wasted. But why does this matter? It matters because of number 6. Another nurse has to verify that a portion of that medication was wasted. They have to independently verify the name of the medication as well as the dose that's going to be given to the patient, as well as the dose that is getting wasted. That's right, another safety check, and we were at number 6, but now we're at number 7, which is that the nurse goes to the patient's bedside and scans the patient's wristband and scans the medication into the computer. So the computer verifies that the nurse has the right medication for the right patient. But wait, there is one final safety check. Number 8, the patient. The patient will often ask the nurse what medication is being given and why, and if the medication doesn't match up with what the patient thinks they're supposed to be getting, the nurse calls me and says, hey, is this actually the right medication? The patient doesn't think they're supposed to be getting this. So we've gone back to the very first piece of Swiss cheese to double check one more time, or octuple check, basically, because there were 8 pieces of cheese there. And I'm sure that I missed some pieces of Swiss cheese that are still in the way of the patient getting this medication. But now finally, the medication has passed through all of the safety checks and the patient can finally get their medication. And that is a lot of pieces of Swiss cheese for that medication to pass through for a patient to get just one dose of one medication. So now that we've established all this, why does it matter? Well, this entire video is about a nurse being convicted of murder because she gave a patient the wrong medication by accident. But when a nurse gives the wrong medication, it is not just that nurse's fault. The entire system has to fail for a patient to get that incorrect medication. The holes in the Swiss cheese have to line up absolutely perfectly, or the medication has to skip a part of the Swiss cheese. The physician, the pharmacist, two computer systems, and the nurse, and the patient all have to fail to catch this error. So it's not just this nurse's fault. The system failed. The entire healthcare system failed to protect this patient. So then, truly circling back to the point of this video, the conviction. Normally, medical errors are handled in civil court. In other words, the remedy for a medical error is not convicting a nurse or a doctor of a crime. The remedy is having the doctor or nurse pay the family to compensate them for the injury they've suffered, for the loss they've suffered in this case. And the medical or nursing board can revoke your license, preventing you from practicing medicine ever again. So I have some questions. Number one, why was this nurse even able to pull Vaccuronium out of the medicine cabinet? Was there a malfunction? Was there a leftover order left by an ICU doctor that hadn't been removed? Had that patient received that medication earlier in their stay and then that order just hadn't been signed off by the nurse? Number two, did the nurse scan the incorrect information and did the computer catch it? If it didn't, then why didn't the computer pick up that this medication was the wrong one or that it was a dangerous medication for this patient? And number three, did a pharmacist verify this incorrect medication? So there are a million more questions I could ask, but I think you can see where this is going. Yes, this nurse made a mistake. She made a medical error, but she made that error on the back of a systems failure. But should she be thrown in prison because she made a medical error? Absolutely not. Now, let's just back up a little. I'm not saying that medical professionals should never be put in prison because of things that happen at their job. If this nurse had withdrawn this medication maliciously and said, I'm going to give this patient the wrong medication, I know that that's happening and this is the wrong medication and I don't care what happens to this patient, I'm just going to do it, then fine, throw her in prison. That is not negligence. That's trying to harm someone, right? You're not supposed to do that. Duh. Throw her in jail, whatever. But that's not what happened here. This nurse made an error. These mistakes are incredibly common. And if we start penalizing people, people are going to be less likely to admit when a medical error has happened. We already have issues with people not reporting medical errors because they fear for their jobs. So when they now have the fear of going to prison for medical errors, guess what's going to happen? They're going to be even less likely to report their medical errors, which is going to lead to more medical errors, more death, more injury of patients. People will not want to admit their errors, even if it means that a patient's life could be saved. And I guarantee you that if this verdict is not overturned, this case and cases like it are going to lead to more medical errors. Catastrophic medical errors that could kill more patients. They're still going to make the same number of errors, but they won't report them. And therefore, we won't create systems that prevent those errors from getting to the patients because we won't know where those errors are occurring. My heart goes out to Ms. Murphy's family and Ms. Murphy and Nurse Vaught. I sincerely hope that this verdict is overturned. If it is not, the true victim of this punishment is going to be our patients, who will be subjected to many more medical errors than they already are. I'm Dr. Jake. See you in the next one. Bye-bye.